Why original Medicare doesn't cover custodial care. In this video, I'll explain why and what Medicare does not cover. Also, I will share with you what it does cover. Why original Medicare doesn't cover custodial care? One of the most common questions we get is why the federal government Medicare plan does not cover custodial care for Medicare beneficiaries. What Medicare doesn't cover, the answer is pretty simple, because it's not considered medical care. Custodial care is the type of long-term care that helps with activities of daily living, like bathing, dressing, and eating, and can be provided in several settings, including nursing homes, assisted living facilities, and at home. And many people do prefer to be home. While Medicare does not cover some types of long-term care, it typically doesn't cover custodial care. So let's repeat that part about custodial care versus long-term care. Custodial care is temporary and long-term care is medical. What is the downside of traditional Medicare coverage? There are a few reasons for this. First, custodial care is not considered medical care under Medicare guidelines. This means that it's not eligible for reimbursement from Medicare. Second, custodial care is typically not covered by private insurance policies either. That doesn't mean that you're out of options. If you need custodial care and are on Medicare, there are a few ways to pay for this type of care, including Medicaid services, private insurance policies, and out of pocket, and that's something none of us want. If you're on Medicare and need custodial care, be sure to explore all your options to find the best ways to pay for it. What does traditional Medicare cover and provide seniors? What are the benefits of traditional Medicare coverage? Well, Part A is the hospital coverage, covers inpatient hospital care, skilled nursing facility care, hospice care, and home health care. Now, inpatient care, of course, is while you're in the hospital. A skilled nursing facilities, after you leave the hospital, is not permanent care, it's just rehabilitation care. Hospice care, as you know, is the final stage of life. And home health care, a lot of people don't know that Medicare does provide for some of those services, even a family member. Medicare Part B, medical insurance, covers doctor services, outpatient care, cataract surgery, home health services, durable medical equipment, and some preventive services. It does not cover drug coverage, dental services, hearing aids, cosmetic surgery, chronic low back pain, vision care, or routine foot care, and does not cover acupuncture or chiropractic services. So, this chart shows you what does Medicare cover: inpatient care, skilled nursing facility, home health care, hospice care. On Part B, preventive services and medically necessary services like your doctor, your annual physical, your flu shot, and vaccines. And in 2023, even the single shot is going to be covered under Part B. What are some alternatives to traditional Medicare coverage? Medicare supplement plans, also known as Medigap or supplement plans, insurance are designed to cover medical expenses not covered by Medicare, such as deductibles, co-pays, and co-insurance. These plans are offered by private insurance companies and must be approved by Medicare. There are 10 standardized Medigap plans available, each with a different set of benefits. You can choose any plan that is available in your area as long as it's offered to people with Medicare. You generally pay a monthly premium for a Medicare supplement plan. You must buy a separate Medicare Part D standalone prescription drug plan. And in this chart, it shows you three of the most popular plans, which is Plan F, Plan G, Plan N. But since anyone that's covered by Medicare after 2021 can no longer buy Plan F. Now, if you were in Medicare before 21, you can still get Plan F. Plan G basically is that it doesn't cover the Part B deductible. And in Plan N, it doesn't cover the Part B deductible or Part B excessive charges. Now, there's a considerable difference between Plan G and Plan N in premium. So if you're fairly healthy, Plan N is a pretty good plan. Plan C is known as Medicare Advantage Plan. Medicare Advantage are a type of Medicare health offered by private companies to cover medical costs. These plans provide all your Part A hospital insurance and Part B medical insurance coverage, and usually all other benefits like prescription drug coverage all in one plan. Some Medicare Advantage plans also offer extra coverage like routine vision or dental care, hearing aids, and or health and wellness programs. You generally pay a monthly premium for a Medicare Advantage plan in addition to your Part B premium. The amount of the premium may vary depending on the plan you choose. When it comes to health insurance plan costs, there are a lot of things that Medicare Advantage and Medicare supplements don't cover. One of them, again, is one of those things is custodial care. That's a very important feature. That's why I made this video. Medicare Part C, Medicare Advantage is hospital, doctor, and prescription. What it means is the 20% that Medicare doesn't cover, these plans make up. What they do is they wrap around your Medicare coverage. So Medicare pays 80%, these plans make up the 20% that Medicare doesn't pay. And just to let you know, some of these plans have zero premium. Medicare savings plans. Medicare savings plans help people with Medicare pay for some of their out-of-pocket Medicare costs. There are four kinds of Medicare savings plans, and each has the different rules about who can qualify and how much Medicare will pay. Who qualifies for a Medicare savings plan? You may qualify for a Medicare savings plan if you have Medicare and need one of the following conditions. One, your yearly income is below a certain level. You have limited assets, you qualify for Medicaid. You have end-stage retinal disease, ESRD. Each state has different income and asset limits. That's why we don't mention them here. If you meet these conditions, Medicare pays for part or all your Medicare Part B premiums. That means that normally that $162 you pay, they would cover it for you. There are four different types of Medicare savings plans: qualified individual, qualified disabled and working individuals, specified low-income Medicare beneficiary, and four qualifying individual plans. Each plan or type of plan has different eligibility requirements. The most common type of plan is the qualified individual. If you are qualified for a QI plan or qualified individual, your state will pay your Part B premiums for you. You can reapply for a QI plan each year. If you do not qualify for a QI plan, you may still be eligible for help from another type of Medicare savings plan. One, you must be enrolled in Medicare Part A, hospital insurance, and Medicare Part B. So you must have Part A and Part B to get these additional benefits. You also must have a limited income and assets. If you qualify, Medicare will pay all or part of your monthly premiums, annual deductibles, and co-insurance. For more information about who qualifies Medicare Savings Plan, visit MedicareSavingsPlans.org. And who are they? MedicareSavingsPlan.org is a website that provides information about Medicare savings plans. These plans are designed to help people with Medicare pay for some of their out-of-pocket Medicare costs. The site provides information about the different types of plans, eligibility requirements, and how to apply. I would go on that site if you feel you have a low income, below $2,000 or so, you might qualify for these plans. Now, what is Medicaid? Medicaid is a joint federal and state program that helps low-income individuals pay for medical care. Unlike Medicare, which is only available to seniors 65 plus, Medicaid is available to people of all ages. To be eligible for Medicaid, you must meet certain income and asset requirements. And just to give you a heads up, in 2023, the income limit has been raised at least 30%, and the amount of assets you can have has been increased by 50%. So if you don't know what they are, you can go on Medicare.gov or call 1-800-Medicare and find out for yourself. Now, in this chart, you see Medicare General for people who are 65 or older who have a qualifying disability, regardless of age. Medicaid is for individuals, families, and children with limited income and resources. Now, let's talk about, all right, you want to know about long-term care. Well, another option for paying for custodial care is long-term care insurance. Long-term care insurance policies vary widely, so it's important to do your research before purchasing a policy. Some things you want to consider include the daily or monthly benefit amount, the length of coverage, and whether there are any prerequisites for coverage, like having to meet a certain level of functional impairment. What is long-term care? Unlike traditional health insurance, long-term care insurance is designed to cover long-term services and supports, including personal and custodial care in a variety of settings, such as your home, community organization, or other facility. Now, you can go to longtermcare.gov for more information, but let me tell you, because most people buy long-term care later in life, the monthly premium can be quite expensive. But if you can afford it while you're young, it sometimes makes a big difference. Now, how can I help you? If you're looking for help with your Medicare costs, an independent Medicare agent can be a great resource. I'm Bill Vargas, a Senior Health Corp, and I'm an experienced and knowledgeable agent who can help you find the right Medicare plan for your needs. He can also answer your questions you have about Medicare or how Medicare works and what your options are. Contact me at 845-380-5809. Please text me because I get so much these spam calls like you do. I request that you leave a message or text me and I'll get right back to you. Email me at bill.vargas@gmail.com or visit our website insuredmeds.com. Please like, share, subscribe, and turn on notifications. Senior Health Corp, I work for you, not the insurance companies. I'm a veteran serving veterans. Please share, like, subscribe, and turn on the notification bell. And also, si habla español. So you or someone you know needs help with the Spanish, I am a bilingual person and be happy to help. See you in the next video. Bye-bye.